Okay, folks, let's go ahead and get started. My name is John Lohman. I am the publisher of the Corridor Business Journal. On behalf of my wife, Aspen, and our entire staff, it's my pleasure to welcome you to the CBJ's Innovation Watch webinar. As many of you know, this event was originally scheduled to be held in person. However, we have decided to offer all of our events in May and June events as free webinars to keep our community safe and informed during this time. This event has also taken on a new sub-theme since we began planning it earlier this year. In addition to learning about local companies' technological advancements, we will discuss how innovation in Iowa is helping to combat the COVID-19 pandemic. We hope that you walk away with a better appreciation of the companies, technology, and people that the corridor has in its midst. The agenda for today is I'm going to just say a few words, and then I'll invite each of our speakers, each of our four speakers to present. They will each have approximately 15 minutes to talk about their innovation. Susan Wood of VIDA Diagnostics will kick off the program, telling us a bit about her respiratory artificial intelligence company. After that, we will hear from Mike Courtney of RSM about robotic process automation. Then we will have Integrated DNA Technology President Trey Martin, who will discuss his company's role in the fight against COVID-19. And finally, we will conclude with a presentation by Michael Ott of Rantizo. You might be thinking about some specific questions that you have for our speakers. If there's time at the end of each of their presentations, we will take a question or two from the audience. You're also welcome to submit your questions in either the Q&A or chat section at the bottom of your screen. Before I introduce our first speaker, I would like to thank our sponsor, RSM US LLP. Without their financial support and input, we would not be able to host this special event. I'd now like to play a brief video to tell you a little bit about RSM.
Good afternoon. We hope this quick video finds you safe and healthy. RSM is the leading provider of tax, audit, and consulting services for the middle market. COVID-19 has changed the world for all of us, but RSM is here to help. We offer services like Microsoft 365, private and public cloud, networking, security, ERP, CRM, and more. Please visit us at rsm.us.com.
Well, thanks again to RSM for being a sponsor today of this event. All right, let's dive right in. Our first presenter is Susan Wood, who is the president and CEO of VIDA Diagnostics, Inc. VIDA Diagnostics is a respiratory artificial intelligence company based in Coralville. Susan has over 20 years of experience championing innovative clinical solutions to the marketplace. Today, she's going to tell us about her company's LungPrint AI and imaging solution, including how LungPrint can help physicians manage patients through the pandemic. With that, Susan, I'll pass the virtual mic over to you, and thanks for helping us out today. Susan.
John, you're most welcome. Thank you for the opportunity. Just doing a quick check to make sure that you can see my screen.
Yes.
Since we're in the new normal here, we always have to check. So I am Susan Wood. I'm the CEO of VIDA. As you mentioned, we are a clinical AI company, and we use imaging and analytics of prediction to manage patients with or at risk of respiratory disease. The respiratory diseases that I'll allude to here are including chronic obstructive pulmonary disease, or COPD, asthma, interstitial lung disease, lung cancer, and now COVID-19. VIDA was founded by four, not yet then professors, but ended up being professors at the University of Iowa. And that foundation was built on establishing a multidisciplinary approach to managing the patient with or at risk of lung disease. The representations from this team include biomedical engineering, Dr. Joe Reinhardt, electrical engineering, Professor Milan Sanka, radiology and biomedical engineering and physiology, Eric Hoffman, and the late Jeffrey McLennan, who was an interventional pulmonologist. We continue to collaborate closely with the university in both research and in clinical practice. And we're very proud to say we've employed over 70 students and graduates from the university at VIDA. Now, it is certainly business as unusual. And it's also a moment in which we think we can draw some parallel conclusions from this quote here, in which our work is its most critical. So, for example, VIDA, as you mentioned, is a respiratory AI company, and we are in the midst of a pandemic. A lot of it looks like the implications of the patients with COVID-19 have strong respiratory indications. We also have a great deal of expertise managing those patients with many of the most severe conditions, as I mentioned, underlying lung disease with COVID-19 and patients with underlying lung disease. It gives them additional risk for more severe conditions. And what we do know is that COVID-19, we don't know exactly how it will form, but will have a long-lasting effect on the management of patients, either finding the indications of COVID-19 early or managing those that have already had the disease for increased risk of other underlying diseases. So just to take you real quickly on lung disease by the numbers here, and we'll show how that relates to our management of COVID-19. Chronic obstructive pulmonary disease, or COPD, often diagnosed very, very late. Just a quick number, over 70% are considered to be underdiagnosed. That means people are walking around with underlying respiratory conditions that aren't diagnosed. Interstitial lung disease, some form of fibrosis, for example, is generally misdiagnosed, and over half the patients they're misdiagnosed in their initial diagnosis. So there's sort of this circuitous diagnostic process to finally get the disease or diagnose interstitial lung disease. And lung cancer is often comorbid with COPD. So there's 3 to 4 times an increased risk of lung cancer with a patient with COPD. So how does lung print help? What we do is we find disease earlier. We find indications of, for example, chronic obstructive pulmonary disease and interstitial lung disease earlier. We increase the efficiency in which we find these diseases, because the lung and its branching tree structure is a very complex field to look through. And we're looking at, and we've employed efficiencies in the way that we read and we manage and diagnose those patients. And we increase the value for referring physicians. We're giving those referring physicians, clinicians, more objective versus subjective information about the disease state of that clinician. So just a little example of how we're using our AI-enabled workflow. This is the normal viewing of a patient. This is a CT exam of the patient with that. In this case, this patient has a fibrosis, and we have a patent-pending technology that finds this very complex tree structure of the lung and is enabled to show the majority of those branching structures in a single image, which we call topographic MPR. Again, this is patent pending, and when used in a clinical study, we found that viewing enables you to reduce the reading time in a chest CT by as much as 35%. So for radiologists in a very, very busy practice, this is crucial to get to be more efficient, to be able to reduce the reading time, but be able to increase the accuracy of which you do that read. Now enter COVID-19. And what we've been able to do is use what we call transfer learning, or the AI enablement of other disease states of the lung and transfer those or use those in our analyses of a new disease state like COVID-19. So our 2020 solution now includes a COVID-19 analysis. We are distributing it through expanding partnerships and sales promotion. And we have obviously for an increased VIDA awareness. So if this is an image of one of our structured reports that we automatically produce for a radiologist. I'm just going to give you a quick rundown of what you're looking at. This patient is what's called a coronal view. So it's sort of cut top to bottom here. And you're looking at the patient's, on your right is the patient's left lung. So it's kind of like looking in the mirror. And these are our topographic MPR. So you see the nice refinement of those airway structures in the single view. That's not typical, but it is more elaborate than you would normally see in the lung. And what we're finding that's unusual in this picture is this. So this is kind of an early indicator or a typical pattern of a COVID-19 patient. Now, if I transfer this image and look at kind of the metrics, what we'll see is in this this characterization of the 5 lobes of the lung, 2 on the left side and 3 on the right, we're finding or we're picking up that indication of early disease in 2 views. So in the lower left lobe, in this characterization, and in this one. So we're detecting that early indication of disease. With this yellow piece over here, is we're finding in one of those lobes of the lung, we're also finding some underlying condition of emphysema or COPD. So again, not unusual, but I'll give you another example. So this is a mild stage COVID-19 patient, may have symptoms, may not, but this would be an early indication of that disease. This is another mild or early stage patient, which you're looking for that's unusual. That would be a typical COVID-19 pattern is this area here. It's light enough. We didn't pick it up in this view. We did pick it up here. But what is sort of informative about this patient is that we have found underlying indications of emphysema in this patient. So across all 5 lobes of the patient, there is some indication of emphysema. And that we know that there's almost a 6-fold increased risk of a COVID-19 progression with patients with COPD or underlying or emphysema. So we're finding a condition that would put that patient increased risk of a COVID-19 progression and an early indication of what the COVID-19 indicators look like. So now I'm going to take you through a more progressive patient. Again, this is a patient with more advanced disease. So in the lower right lobe here, which we're showing in this lobe here, you're finding indications of disease. So this gray area here is kind of normal lung, and this sort of lighter area here is an indicator of higher density or abnormal lungs. So we're picking up the indications of disease here, and we're also picking up it in these 2 views. And again, some underlying condition of emphysema also in these lungs. So this patient will probably have more severe symptoms. We're also picking up indications of disease over here, which you're seeing. I'm just not highlighting those. So in both lower lobes of the lung, we're finding indicators of COVID-19. And then as that patient gets more, I'm not going to circle anything on this because it's everywhere, but you can see the blue, we're picking up indications in all the lungs. So this would be a very advanced patient. So with that, I would say that we have very strong marquee partnerships, and our 2020 goal is to continue to develop, sell, market established lung print is integral to managing patients with a myriad of respiratory conditions, including COVID-19. So with that, I'm happy to take any questions.
Thanks so much, Susan, for that interesting presentation. Can you give us just a little bit of a level of understanding of how widely used your technology is right now, either in Iowa or the United States or the world?
Well, we have over 450 sites that some form of this technology is used around the world in over 30 countries. We have a very strong validation component to our technology that we use in academic and clinical trials. And once our biomarkers or AI is validated through that solution in a clinical use case, so probably close to 100 sites worldwide using it clinically, and about 350 of those sites using it in validation trials.
So where is VIDA in regards to the evolution of a company? It's really no longer a startup company, is it? So where is it right now, and where do you see it headed over the next couple of years?
Well, we've recently raised what's called a Series C financing, a third financing, which not a perfect indication, but it generally we're revenue producing, and obviously economically the COVID-19 crisis has hit us all, and our ability to go into and aggressively sell into some health systems, but that was raised on growth revenues and bookings for the company. So we're revenue producing. We're still very, we still have a lot of market out there, very much on the growth curve, but have, I think, always had a great opportunity in respiratory care, and now even a greater opportunity with the unfortunate situation that we're in right now with the worldwide pandemic.
So another question from the audience, Susan, what is your main challenge in extending your market reach right now, or when pandemic is over with?
Will it be over? So the main challenge, I think, obviously, is that we have a new world out there. So I think that it's hard to predict when it will be over. I think we are in a very acute selling situation now that's unusual. So that's, of course, a increased or a different type of challenge. I think that we spent the last 12 or so months establishing very marquee distribution partnerships. And so I would say it's a good challenge, but we work very well with those partnerships and getting that combined sales energy into the marketplace with our strategic partners.
Great. Well, Susan, thanks so much for spending time with us today, and good luck as you continue to evolve and grow the company, and hopefully we can get you back in the near future to keep us updated on the good things that you folks are doing over there.
Yeah, thanks for the opportunity.
Thanks so much.
Bye-bye.
Okay, moving right along, our next presenter is Mike Courtney. Mike is a principal technology and digital management consultant at RSM US LLP. Mike has over 20 years of experience defining strategies that are enabled by leading edge technologies. These technologies include robotic process automation, which is what he's going to talk about this morning. Mike, thanks for being with us. I'm going to turn the mic over to you.
Thanks, John. Glad to be here. Hope everyone's safe and well. We're going to talk a little bit about automation technologies and specifically RPA today. The slide you're seeing today, right now, is what I like to call the automation spectrum. This helps lay out a landscape of kind of three big categories of automation technologies that exist out there today. On the left-hand side of the screen, you'll see basic automation. That's the category where robotic process automation lives. It's a fairly basic type of automation, but it's being used very widely across many enterprises today. And so it'll be a good relevant topic for today, as well as we emerge from the current situation. Intelligent automation is a little bit more complex type of automation, where now you start involving technologies that can start learning like a person. You heard some of the descriptions that Susan was using in her discussion around machine learning and algorithms. That's where these technologies start coming into play. So now you start having technologies that can actually apply some of the things that they have learned based on data, as opposed to programming, as opposed to computer programming, for example. So now they're building algorithms that are essentially based on observations or data facts that have occurred in different scenarios, and then applying those to help provide guidance or judgment relative to what the particular scenario is that is being asked of the solution. And as well as being able to facilitate somewhat unstructured types of interactions. So if you think about unstructured data, think about the example of Word versus Excel. For example, Excel, we can all follow the row and column concept, so we would kind of use that as the descriptor for structured data. And unstructured would be like a paragraph in a Word document. It's something that you don't necessarily know, unless you know English or the language that you're reading, how to interpret what's being said. So that's it's a little bit step up. And then the last piece here is around cognitive automation, and Susan's, I couldn't have really followed a better example. What they're doing over at VIDA is a great example of cognitive automation. This is really where you're applying multiple different types of the umbrella term of artificial intelligence to create solutions that can help automate different functions. You saw the example of reducing cost or reducing time around a radiologist reading a lung image. This is an example of where cognitive automation is making a significant impact. It's being able to take very complex situations and being able to interpret them and put them into a context that a professional can be able to interpret faster and easier, and probably potentially with better judgment. So I like to use this slide. I always highlight when I talk with folks that if you don't remember anything from what I talked about, just remember this one slide, because it will really help you try to kind of categorize different types of buzzwords and terms that you might be hearing out in the market. Within robotic process automation specifically, again, talking about a basic type of automation capability, it's an automation technology that's very prevalent across enterprises today. And the concept here with robotic process automation is not that you have physical robots, think of R2-D2 or C3PO or some of the more current ones, but rather computer programs or computer robots. So these are software robots that are actually, they have the ability to interact with application systems that you use today, much like a human would. So one of the big benefits around that is by interacting at the graphical user interface or the screen level, what that's enabling is to maintain the security, the controls, the restrictions that we have around how users are interacting with systems, and being able to keep those in place even though it's a software robot that's interacting with the system. So that's a very key benefit here. But the other side of that benefit is software robots don't take coffee breaks, they don't read email, they don't go on vacation, they don't get sick, they don't do all of the things that humans can do that can impact productivity. So I like to highlight that, and three of kind of the key market leaders out there are Automation Anywhere, UiPath, and Blue Prism. There are several other providers out there. Microsoft has offerings in this space, as well as a few of the other players and big names out, such as Google and others. But these have been the three players that have been most prominent in the market and have been able to establish very mature platforms to be able to provide this type of capability for enterprises. The key here is, I guess, example use cases are manual data entry. So things that people are doing today that are repetitive, redundant, but very black and white decisions. So, if you're familiar with any kind of structure, if then else decisions, if you've done, advanced macros within Excel, these are, akin to that, but significantly more powerful. So manual data entry is very, very common. Multi-system data retrieval. Many organizations have multiple systems where information may reside. And rather than having a person going through and collecting all the data relevant for a decision or an insight or a report from all those different systems, you can have a bot go out and collect that data and be able to help you consolidate and create that information or take that action, whatever it might be. And then another key here is around validations and controls. While having controls and making sure we have quality checks and are aligning with governance requirements, it's not necessarily, it's valuable or it's important, but the value of having a person do that can be limited because many times it's just checking boxes and going through different routines to identify gaps. And what you can do with bots is be able to have the bot go out and collect those data points, be able to do very specific evaluations on the comparison between 2 items, 3 items, 10 items, 100 items to see if there's any variation within them. And if so, then it can alert someone, a human typically, to be able to take action, or it might alert a different bot to go take action and shut off some access, or contact a human, or open up a case for investigation, or contact the authorities, or send a text alert, or 100,000 other different kind of scenarios. So, these are just a few of the example cases that you might find where RPA could be applicable. And then over on the right-hand side is a nice little graphic that just outlines some of the key benefits. I think it's interesting. The one that I always like to highlight on here, that most of them are fairly intuitive, but many people ask about improved employee morale. And this is really a key one, because what we're finding is, as these technologies are applied, the removal of those tactical, repetitive tasks that people are spending, an hour a day, 2 hours a day, sometimes a whole day, potentially doing, by having software robots be able to do those tasks, it actually empowers a person to be able to move on to more high value, more engaging, more analytical type work, which is definitely improving their morale. If they don't have to spend the first 2 hours of their day going to 10 different systems collecting data, that can help people kind of start off their day much better. So I think that that's always an interesting one, because that is showing the impact of technology and specifically robots and the relationship they're having with employees and with people. So final slide here is some of the ideal use case scenarios. I rather than talk to all the bullets on the right, I usually like to touch on the big circles on the left. Rules-based, so clear black and white decisions, again, if then else, yes, no type decisions are what these technologies are built to handle primarily. High operational impact, so you typically want to look for something that's going to have high impact relative to the organization, but ideally low complexity. And there's a lot of those types of tasks that exist within organizations. You want to evaluate the extent that you can automate, so don't necessarily look at just one piece of the process. Maybe look at the whole process and then evaluate your ability to automate and apply these types of technologies across that whole spectrum of the process, as opposed to just one narrow piece of it. Multi-application interaction, as I mentioned earlier, these technologies, because they interact with systems at that user interface or at that graphical interface, that's really where their power is, because then they can be able to interact with multiple systems, multiple websites, multiple data sources to be able to collect or help complete actions. Scalable and repeatable, that's one of the other key areas is you want to think about tasks that are repetitive and are consistent, but then the ability to be able to scale these solutions to be able to help meet those needs very quickly, so that you can add 1, 2, 6, 8, 10 robots to do a particular task, and you don't have to train them. They're already going to know, because they've already been constructed or configured to be able to do the same thing every single time. And then the key thing here, and this is a lot of the buzz that's out there in the market about robots taking jobs, et cetera. The reality is what we're seeing is these technologies are augmenting the workforce. They are enabling people and organizations to do more with what they've got, as opposed to being able to add to their cost of operation by whenever they grow through acquisition or through market growth or through other factors, being able to continue doing the things that they're doing with very high quality and very high efficiency, but without necessarily having to add a lot of additional workforce. So this is just a little bit of a soundbite around robotic process automation, as well as some of the other technologies that are out there. I appreciate everyone's time today and the opportunity to talk to you about it. Any questions?
Yeah, great. Thanks, Mike. We do have a couple questions here. One question from the audience is the basic automation an example of what Governor Reynolds is using to make decisions on when to open up business after the pandemic or during the pandemic? Do you have any insight into that?
I can't necessarily speak exactly to the techniques that they're using. I would be surprised if a basic automation is what they're using. What I would assume is it's some form of probably more of an intelligent automation category, kind of that middle bucket, because there's a lot of data and a lot of statistics that I would imagine that they're having to go through in order to determine, what the impacts of opening things up might look like, and what those predictions might be. So I would assume it's probably more in that middle category, that intelligent automation category, as opposed to basic.
Great. And are there some specific companies or industries that have kind of surprised you that they're utilizing this, or is it pretty much in line with what you thought they would be, the type of industry or company would be using this type of technology?
Yeah, not necessarily one particular industry that has surprised me. I will say this, that it is pervasive across all industries. Many organizations or many folks are thinking, oh, well, I could see, financial services or some of the high tech companies using some of these technologies. And the reality is they're being applied across the spectrum within, all industries, as well as across all of the functional areas within an organization. So it's not necessarily something that's purely being applied within finance or supply chain. They're being applied front to back, everywhere from customer engagement, customer interactions, all the way back through the back office and the finance functions and financial reporting, et cetera. So it's pretty, like I said, pretty pervasive, and really the use cases are, what is probably more surprising is the creativity that some of the clients are coming up with relative to use cases and how they're leveraging these technologies. I think that's one of the parts that's actually very exciting and very interesting, is when you walk into a new use case and the creativity of the client says, is it possible to do X? And then, kind of set you off on a little bit of a journey, which is always exciting.
Hey, Mike, last quick question for you. Give us an idea of the cost to implement something like this for either a small business or a medium-sized business. Can you help us get an understanding of costs?
Yeah, great question. And it's a little bit of a challenge to give you a pinpoint. But, I would say that an average implementation, and it's going to vary, there's a number of different factors that can influence it. But that's one of the attractive area or options of the technologies, is the barrier of entry is fairly low in the grand scheme of what you might look at for a CRM or an ERP system or some of the more complex solutions that clients might be using. But you can enter into this space for somewhere between probably 10 and 50,000 is kind of probably a starting point, and then it depends again on complexity and scale and how you want to apply it. But again, they're very reasonable entry points. And then the other thing I would highlight is there are open source versions of these technologies that are out there available. And so if you have people that are have some level of technical savvy to them, they can explore those, and those are no cost. Now, there's the flip side of that, is that you don't necessarily have the strong capabilities of a market or a product, but you can still apply the technologies.
Great. Well, thanks so much, Mike, for helping us learn about this technology, and hopefully we can have you folks back again sometime in the future. Thanks so much.
Absolutely. Thank you.
Okay, next up we have Trey Martin of Integrated DNA Technologies. Based in Coralville, IDT was the first company in the nation to have its primer and probe kits approved by the CDC for use as a key component of the CDC Emergency Use Authorization Testing Protocol for the diagnosis and detection of COVID-19. Since then, the company has produced primer and probe kits sufficient to enable approximately 30 million tests to be conducted in the United States. As you can imagine, Trey is in high demand right now. He could not join us today, but he did provide a video to tell us about IDT and how they pivoted their operations to help with this pandemic. Let's watch the video.
Hi, everyone. Thanks for coming today to listen to me talk a little bit about IDT and our role in the global pandemic, specifically in detecting the coronavirus. So I'll start with a bit of an introduction to IDT for those of you who aren't familiar with us, and then talk about how we have specifically fit in here with the response, in particular in the US with the FDA and the CDC, and then a few notes on moving forward. So first, an introduction to IDT. IDT's history goes way back. Hopefully most of you in the corridor are familiar with us. We've been here since 1987. When Dr. Joseph Walder founded Integrated DNA Technologies Incorporated, which was a joint venture between he and Baxter Healthcare. Joe was a prolific inventor at the University of Iowa Department of Biochemistry and had several very high potential technologies that Baxter was specifically interested in. And that arrangement went for about 6 years until we started to sell a product that Joe had been using for his own research to the outside world. And that product is called a custom oligonucleotide. In this case, we are assembling sequences of the bases you're all familiar with, A, G, C, and T, that allow various genomics researchers to do almost any kind of application in their field. And I'll touch a little bit on that later, but you can see in orange all the different types of products we've introduced over time in growing globally. In fact, globally you got to have the obligatory map slide here. So IDT now has 10 locations, many more buildings, 1,500 associates, which is what we call our associates in a Danaher operating company, 130,000 active customers, which means people who have ordered from IDT in the last 12 months. Our products now range from single-stranded oligonucleotides to double-stranded gene fragments and even whole genes cloned into plasmids. We take over 4,000 orders per day. 95% of those orders come in through our website, and over 95% of them are actually custom made to order. So the website is a really great tool for us to take that information from a customer or from a design tool and put it directly into our manufacturing systems. We started obviously here in Coralville, Iowa, and built a secondary facility on the West Coast to service the West Coast. We've just finished our East Coast facility in Raleigh, North Carolina. We went to Belgium in 2007 and into Singapore in 2013. So oligosynthesis, I promise this will be the only chemistry slide you see. The process is what we call a cycle, where you're introducing a monomeric element, the A, G, C, or T base that you're familiar with, to a growing chain. So it's a single base addition polymer synthesis on a very high surface area solid support. You can see an electron micrograph there. It looks a bit like a coral or the surface of the brain. The idea there is that the solid support gives us as much surface area as possible so that we can build as many of these molecular chains as possible. But we add the bases one at a time in what we call this synthesis cycle. And the analogy I often use is like dropping different colored beads onto a string to get a very specific sequence. So that sequence, that you could think of it as the colors reading from one direction to another, is what gives you the specificity to find your match or to do all sorts of different kinds of experiments in and across genomics, from things people should be fairly familiar with, like human genome sequencing. Requires different kinds of oligonucleotides. Genotyping, like 23andMe and Ancestry.com. Personalized medicine is the use of people's specific genetic expression in different sorts of conditions to tailor the therapy for things like cancer. Many people might have heard of CRISPR. CRISPR is a powerful new technique that uses RNA oligos and enzymes to do gene editing to hopefully fix mutations that could be deleterious. So there are many, many different uses for custom oligonucleotides. And basically the way our business works is, again, that website is the portal. Researchers can come and use different design tools to design their components, or they can specifically enter them. We have written hundreds of pieces of custom software which allow you to take the information they've entered, put it directly on our manufacturing systems. Those systems are actually designed and built here in Coralville as well. Across the street, the old Harley-Davidson dealership is now IDT's Engineering and Instrument Center, where we design and build all this equipment for every location in the world. So then after manufacture, we do post-synthetic services with liquid handling robots, very custom high throughput QC with electrospray mass specs. And then our shipping and distribution center here at 1710 ships over 4,000 overnight packages per day to the customer. The reason for all of this speed and about 75% of the time, 24-hour turnaround, is that the customer only knows what they need from IDT when they're ready to run a new experiment. So we try to be as fast as possible so that we can get them the product they need. They can find the answer they're looking for and hopefully move on to the next question. So IDT's response to coronavirus has to do with some of these similar kinds of applications. Obviously, with the nature of our business, we are usually involved in people researching just about any kind of infectious disease with a genetic origin. And you can see some examples here on this slide. But to get specific about COVID-19, the US CDC, just like the WHO, is responsible in the United States for identifying and typing new infectious diseases. So they did so at the very end of January, as you can see here, having designed a relatively simple panel to run qPCR on this new novel coronavirus. When they did that as their partner, we were able to take those designs and essentially configure a made-to-stock product that could run these assays. And we were basically posted the pre-order online the next day, and by February 10th started fulfilling orders for a research kit that followed the designs and protocol of the CDC. On the 25th, IDT was contacted by the FDA to see if we could support the scale-up of CDC testing. So the next night, as usual, we shipped them some samples, and after a series of validations by the CDC, the FDA and CDC authorized IDT under what's called an EUA, an emergency use authorization, to start selling the CDC configured kits for qPCR to any of the CLIA labs or Hygienics labs that could use them. IDT has done manufacturing under ISO 1345 for over a decade, which is the medical device directive in the ISO. In the US, we call this GMP for medical devices. And we're following the recipe and the protocols for the CDC's primer probe kit ratio. So on the week of March 9th, within 1 week, we had manufactured 2.5 million reactions worth of material. I say reactions specifically because each one of those kit boxes you see there can test up to 500 samples. And then a week later, as we had promised the FDA and CDC, we got to the point where we were shipping 5 million reactions per week of this configuration. And as of last week, we have produced over 30 million test reactions under the CDC EUA protocol and have shipped them many places, as you can see here, predominantly in the United States, at first under the direction of the FDA for high priority areas, but now, as you can see, very much all over the world. So an important note, IDT's assay kits here are not a direct-to-consumer kit. We are not a diagnostic company in that we don't sell a direct-to-consumer or kit or market a specific test to patients. In this case, we're a research product company that was authorized under emergency use authorization to help supply the country and the world with these test kits. And these institutions that would use this kit are hygienics labs, like our own state of Iowa hygienics lab up the road, and CLIA approved medical labs that are certified to run tests. And it's not just the IDT components that you need. Specifically, you may have heard in the news that once we helped alleviate this bottleneck for the primer and probe kits, there were other supply chain issues with scaling up the necessary swab kits and the media for transporting the swab kits to the labs. So those are the first two steps before you can combine IDT's primer probe kits with a reagent called master mix and run a procedure called quantitative PCR or qPCR, and a little machine where the sample is amplified, and if a specific target sequence is detected in that process, the process lights up fluorescently and the machine can quantify that and tell not only that it's there, but relatively how much is there. So moving forward, we have actually recently expanded our test panel kits to include the WHO kit, which was designed differently and is more routinely in use in Europe, as you see that, although people are trying different means of assessing coronavirus in patients all over the world all the time. We're assisting a number of customers who are in the vaccine world with our synthetic gene fragment products. These products are assembled from IDT's core oligos, but are quicker to use in various assays that include antibody development, which can hopefully assist pharmaceutical partners who are joining the fight here. NGS, next generation sequencing, is a methodology that gives deep information not only about patients who may or may not be able to show susceptibility or resistance to the condition, but also the virus itself. Is it mutating? Are various elements coming on and various elements falling off as it marches across the world and goes from patient to patient? So deep sequencing in next generation sequencing, or NGS technology, can allow our customers to figure those things out. So obviously we're going to continue our role in the fight and helping any and all customers who are working in all of these different areas to fight the pandemic, as well as all of those doing incredibly important work in cancer and other aspects of human health. So thank you.
And thank you for supporting the over 1,000 local IDT associates as they continue to do their best to grow IDT's global business every day, and specifically to help in the fight against the coronavirus. This is Trey Martin from IDT, signing off.
Thank you so much, Trey. And IDT is really one of those amazing stories that we have in the corridor for entrepreneurship and the growth that they've been able to accomplish. It's really an amazing story. And we have the makings of another amazing story with Rantizo. We're very fortunate to have Michael Ott, who is the CEO, with us. When we talked to Michael earlier this year, he planned to talk about how innovation in agriculture has adapted over time. But since the pandemic, this topic has become even more relevant as his company has also created new applications for its drone technology. And we're very fortunate to have Michael Ott with us today. So Michael, I'm going to turn it over to you.
Sounds great. Thank you very much for the opportunity. I'll share some slides and be happy to answer any questions. All right. So what we have been focused on for a long time is the labor problem in agriculture. And you can see here, a lot of people say that drone spraying is the future of ag, and we like to correct them, saying that it's the present of agriculture. Like that. Rantizo is the only company that is licensed in multiple states spraying on label with insurance from a drone. We're doing this in about 15 states. I'll show you that list here later on, but we're really excited about the things that we've been able to do in agriculture, and then taking that spraying opportunity and then adding it on to the sanitization work. So in the ag market, the big focus is on labor. We're really looking at custom applicators who do the vast majority of this work. And like the speaker from RSM was talking about, that spraying is work that people don't want to do. That's basically the least desirable thing to do on the farm. So the ability to automate that is really a big opportunity for us. What we can do is make chemicals more effective by decreasing resistance. What happens is we tend to over apply those chemicals, and there's a lot of issues with that. What we can do is be much more precise. Here you've got, it was a rainy situation, like it's been the last couple days around here, and it's going to be coming up much more so. You've got a $200,000 tractor tugging out a $400,000 sprayer. That's $600,000 of equipment that isn't working simply because of mud. Here's an equally muddy situation where our drone sprayer just gets up and over it. And in this situation, the drone was the only solution that worked. So it was too muddy for a tractor, too close to an airport for a plane, and it was an insecticide that makes your lips go numb, so none of the employees would backpack spray it. So this is another thing, we're seeing these crop protection chemicals becoming more and more toxic, which is needed. We want to get that away from people. So the Rantizo solution is currently spraying about 14 acres an hour. That's with our boom and just spraying 3 gallons per acre in the field. In the next few weeks, we'll roll out an automated mix and fill system that will autonomously reload the drone and increase our productivity around 23 acres an hour. By the end of the summer, we should be swarming, where we're flying 3 drones at once. And with that, we'll be doing about 60 acres an hour, which is just about what a tractor will do. Future iterations will get us up over 100. And I'll show you how this works. So when you've got a problem in your field, say that this is insect 1, insect 2, and weed 1, you'll spray 2 insecticides and an herbicide all over the field. So you spray this area that doesn't need it, you spray that area that doesn't need it, and that causes a lot of resistance because you're spraying those chemicals in spots where they aren't required. What we can do is fly right in and drop it right there. I'll walk through an example. This is down in Washington, Iowa, so about 30 miles south of us right now. And farmer knew that there was a problem, and we did some scanning work with a company called Tyrannus, and we found yellow streaking on the leaves. So with that, we discovered there was a micronutrient deficiency, but didn't know which one it was. So we sprayed a bunch of different things, and it turns out it was copper that was the issue. And you need copper to more optimally use your nitrogen in the field to get that yield. So we were able to show that we increased copper levels. Pretty cool. Ultimately, nobody really cares about copper, but we increased it by 50%. What we really care about is yield. So we showed a 2.6% yield increase in soybeans in the field. So this is the treated area that was the problem. When we sprayed just water in that area, we had no benefit. When we sprayed the copper in an unaffected area, there was no benefit. So we showed that we could find the problem, understand what it was, spray just what was needed, and just get in those locations. Another interesting thing that we're doing, we're the first and only company to ever pollinate corn from a drone. This is going to be a monster opportunity for seed companies. We can actually naturally cross corn that is now bred in different locations. So we could take a Brazilian corn and mix it with an Iowa corn, and we can do that without genetic modifications, which is a new thing that's going to be really appealing for, especially for seed companies. We've then added on sanitization as a service. So we looked at what we can do in terms of spraying, and we actually got called by a big league baseball team, like a major league team, and they said, can you spray our stadium? And we're like, well, yes, we can do that. Like, that's not that hard to do, but we needed to figure out what chemical to use, how to set up the pricing, look at all the legal ramifications, handle the regulatory work. And since then, we've rolled out a nice package that a chemical that kills the coronavirus, and then 99.999% of other bacteria and viruses. We've got a traditional version. We also have an organic chemical that can be used for that, if people want that. We can do the pricing per square foot. So if you're doing like a public park, or some warehouse or anything like that, we figured that out. Also for stadiums, concert venues, and other things, we can do it per 1,000 seats. Work with the customers to see what they need there. We've had tremendous enthusiasm about this. Working with a group that's wanting to get all the state fairs, hopefully to be able to have them actually be able to go this year. We may be able to sanitize them potentially like every day, because like a lot of us have been to the Iowa State Fair. They have different concerts every night, so we could show after the show, first thing in the morning, get up and go spray that venue and reapply. Same thing at a public park, same thing at a warehouse. Work through all those things, and we like to do things autonomously, where the drone is using its capabilities, flying itself, using the train follow, and having collision avoidance so we don't run into anything. So I always say that we have a SaaS model, and for us, it can be sanitization as a service or spraying as a service. But we also have a hardware component where we're selling the drones. We do support and training. Actually, we have a big training session later this week. We've got groups coming. There's a lot of interest from all over the country because this is an essential service that people need to be able to spray their crops. So we do that. We also generate recurring revenues in partnership with our contractors. We capture 1/3 of the revenues that they generate. Our platform is focused on a bunch of different components. It's not just a drone sprayer. So we've got an upgrade kit, which I'll show, a mix and fill, software suite, load everything into a trailer, and then we're providing the whole suite of services in terms of training, support, and insurance and billing. So I'll walk through a little bit of this. So our drone has a 14-foot wingspan, and it sprays a 20-foot swath going through the field. And this is entirely autonomous. We actually don't fly the drones. The drones fly themselves. So we program them where we want them to go. And you can do full field coverage, or you can spot spray. There's a lot of opportunities in spot spraying that really help with reduced chemical usage and then also reducing resistance. And with this, we're now spraying around 14 acres an hour at a 3-gallon rate. We can do dry applications like cover crop seeds. That really extended our season last year for us, which was pretty exciting. What we were able to do in the middle of the year in all those washed out wet spots, remember how rainy it was last year, we could map out the affected area inside a field and drop cover crop seeds, or we can fly along a waterway and maybe reduce runoff by planting strategic things right where you want them to go. So it's a big advantage to be able to be really, really precise like we are with our technology. Our automated mix and fill system, we're rolling this out here in the next few weeks. What this is going to do is autonomously reload the drone. So we've already got autonomous flying. Then we're going to do autonomous reloading. So we're getting to a spot where we can be completely unmanned in the field. which is really desirable. That's what needs to happen for these agricultural spraying opportunities. And what this does is it reduces the amount of time the drone is on the ground. So we're going from 2 minutes of reloading to about 30 seconds, and that just increases your productivity. Also, we're really, really precise with what we're doing. We can make very precise batches, and we can even change if you want to spray an insecticide on one side of the field, herbicide on the other side, and then drop cover crop seeds in a different portion. We can get really precise about that. So we're currently permitted in about 15 states. You can see them. Every state that has our big logo is there. The little logos are where we have contractors that are working. So most states have reciprocity, meaning that if you're in one state, they'll let you work with something that crosses the border. So you can see we're essentially touching every state in the nation, except for maybe the far Northeast. But everything that we're working with, we can get into just about any state, and that's really helped as our growth has accelerated in the last few weeks. We've actually seen a big uptick in sales in the last 2 months due to the coronavirus because of, once again, all the labor problems that people have. They want to use these automated systems. So we're doing this in partnership with a lot of different companies. DJI is the market leader in drones, working with imagery companies like Taranis, Sony, and FarmDog, big chemical companies like Syngenta. KZ Valve is building our mix and fill systems. And it's really smart, I think, to have an open partnership. And we've had that mentality that we want to work with other companies. We're kind of good at what we do and then look for partners in that. I'm really proud of our team. Highlight a few people. My background is in chemistry and venture capital. I hired Mike Schmitz, who has been fantastic. He used to work with Deere, and he's designed our entire system. Gerald Baratek has been working with us on designing all the different things that we need. Added Randy Cooper and David Piper, who have a lot of experience in sales and in business opportunities. Emily Carlson is a great entrepreneur and a graduate of the Iowa Startup Accelerator. Bo is focused on automation technologies. He's really got a great background in documenting processes and making things run smoothly. As we're automating all this stuff, it's really important for us to be as slick as possible. And as we're scaling for growth, his work is really important. And then Caleb is an extraordinary drone pilot. He's got hundreds of hours of flight. And when you realize these things are flying for 3 to 15 minutes at a time, to get hundreds and hundreds of hours, he's been up there a long time. He's one of 4 people in the country that's certified by DJI to train and support the drones that we have. So I'd like to wrap up with a short saying that really summarizes everything that we're doing. And I realized that Forbes did that for us when they tweeted, "Rantizo is revolutionizing spraying, a $36 billion market." That was a pretty cool thing. We also got featured very briefly on 60 Minutes. And then recently in the Wall Street Journal, there was an article about the Microsoft CTO when he brought up what we were doing as a fun innovation and an exciting thing for him. It's actually in his book that's coming out very soon. So we've been excited about the press that we've had, but more so we're excited about the opportunities to be in the fields, in warehouses, in stadiums, in venues, to be spraying things in an efficient, cost-effective way, whether that's an agricultural opportunity or a sanitization opportunity. We like to really drive efficiency, and that's what we're building and pushing forward today. So thank you very much for the opportunity to talk, and I'm happy to answer any questions.
Great, Michael. Well, thanks so much for sharing that interesting information about your company. I wonder if you could talk a little bit about the main challenges that you're having in extending your market reach right now.
Sure. So just figuring out what is needed in agriculture on that side. Basically, everybody's going to get planted. That's not going to be much of an issue. But looking at the logistics and shipping, that's really a big problem that we're seeing right now with all the coronavirus-related logistical issues. We're having some problems getting things in. That's why we try to do multiple sourcing, so buying things from 2 to 3 different entities. There's some things that we can only sole source. There's a couple things that we need that only one group can make that we found. So that's a big issue. On the sanitization side, it's getting people out and just showing what needs to happen. I think there's a big concern there about making people feel safe And when what we can do is sanitize a park, a stadium, whatever it is, and then let people know that there's that, you know, we're spraying things that are killing the coronavirus, and get them back out. And a lot of these venues are really excited about that opportunity.
Well, I think we're going to wrap it up there, Michael. I'm having a hard time hearing you, but hopefully the other folks that were tuned in have been able to hear that last little bit of response. So fascinating business, great information. We'll be cheering you on and looking forward to more of your growth at Rantizo. I would like to now thank our sponsor again, RSM US LLP, one more time for their sponsorship. You can read more about technology and innovation in Iowa in the May 18th issue of the Corridor Business Journal. We also produce a free Innovation Watch e-newsletter called Innovation Watch, which is a weekly roundup of tech, STEM, and innovation news from around the corridor, delivered to your inbox every Tuesday by 4 p.m. You can go to our website at corridorbusiness.com to subscribe to the Innovation Watch e-newsletter. And before we go, I did want to mention a couple upcoming CBJ events. On May 28th, we will host our annual 90 Ideas in 90 Minutes event on Zoom. This 5th annual event invites 9 corridor leaders to share 10 of their best ideas and rules to live by that can be applied to any business. Speakers include Tony Bedard from Frontier, Nate Kading, Mary Kempf of Pearson, Leslie Nolte of Nolte Academy, and many others. And then coming up on June 24th, we will host our annual mid-year economic review event. We're very fortunate to have Charlie Evans, the president of the Federal Reserve Bank of Chicago, as our keynote speaker. And after his keynote, we will have a panel discussion of local and regional industry leaders, moderated by Jack Evans of the Hall Perrine Foundation. Again, that's one of our premier events, and that's coming up on June 24th. Again, all of our events in May and June are free webinars. You can find out more and register for these events on our website at corridorbusiness.com. And then finally, I have been asked by folks how they can help the Corridor Business Journal during this challenging time. And after you leave this webinar, you will be redirected to our website. If you found value in the webinar and would like to support the CBJ, really the best way is to subscribe to the weekly CBJ. But if you're not if you are a subscriber to the CBJ, there is also an option to make a one-time financial contribution. Again, most of these events that we've had, all of the events in the past have been events that you would pay for, but we've been offering them for free. But if you are a subscriber and would like to make a one-time financial contribution for this event, that would be helpful. So thank you again for joining us this morning. Keep reading the weekly Corridor Business Journal, and we are adjourned. Thank you very much.